Welcome, Dr. Patrick Bailey. Dr. Bailey is a clinical professor of surgery at both the Uniformed Services University and at George Washington University. Dr. Bailey plays an invaluable role to the American College of Surgeons as he is our Director of Advocacy within our Division of Advocacy and Healthcare Policy. Welcome, Dr. Bailey.
Thank you. Pleased to be with you.
On normal circumstances, I know from the reports that you give to the Board of Regents, you're incredibly busy in Washington, D.C., helping fellows to help our patients, but not everybody may be as familiar with the invaluable work with you and Christian and Franco Pelco all provide. Perhaps you could just give us a little thumbnail sketch of what the advocacy team does in Washington, D.C.
The Division of Advocacy and Health Policy has about 20 staff located just off Capitol Hill in the 20F building that the college has there in Washington, D.C. We have essentially 4 shops, as I call them, in the office. We have a state affairs shop with John Sutton, who's been with the college for well over 20 years, and Chris Johnson are in that shop. Then we have a quality affairs shop that Jill Sage, many fellows will be familiar with. She is in charge of that. And then a regulatory affairs division that Vanita Alapali heads up, as well as a legislative affairs division that Kristen McDonald heads up. So those 4 components make up what we're doing in the DC office. And actually all 4 are incredibly busy right now, working within their space to try to help people get through this very unusual set of circumstances.
Well, I'm glad you touched upon the unusual set of circumstances. So now during this pandemic, you guys are sort of permanently engaged in 5th gear, trying to get things done for surgeons, to get done for their patients, for our patients throughout the United States and for the public at large. Could you please describe to us some of the efforts from the advocacy agenda that have been accomplished very quickly, I might add?
Yeah, we've been very intimately engaged with the legislative agenda and with the various components of financial assistance that are coming out. The quality affairs team, for example, has been engaged in trying to get CMS to modify some of its requirements relative to the MIPS program. Vanita and the reg team are very engaged with trying to get CMS to ease some of the regulatory burden upon surgeons during this period of time. And State Affairs has been very, very intimately involved in various executive orders on medical liability as well as licensing.
There's another agency with whom you may be interacting, which is OSHA, relative to the personal protective equipment. And maybe you can talk about how the college is advocating for patients and their healthcare providers.
So over the last several weeks, we had heard some feedback from fellows about some difficulties with personal protective equipment. And so I looked into some of the regulations relative to OSHA and what is required, and provided an update in the newsletter that appeared on this past Tuesday, which would have been, the 7th or the 8th, whatever the day was with that, specific to that, just trying to give fellows some guidance about what it is that those regulations provide so that they could use that in their conversations with their administration.
In terms of provisions, one of the other provisions is dollars being provided by the government. $2 trillion relief package thus far, and a large chunk of that is for healthcare. So can you please explain to us how an individual hospital will be able to access any funds to make up for the loss of elective surgery, having to focus strictly on COVID-19 patients and on urgent surgery? Let's tackle that one first on the hospital level.
Yeah, at the hospital level, they're going to be somewhat capped by the fact that for example, the Paycheck Protection Program and the EIDL program, the Economic Assistance Program directly through small business, those are capped to organizations that have 500 or fewer employees. However, we're speaking here on Friday morning and just knew out this morning that CMS has let began to distribute $30 billion to providers percentage-wise based upon what their Medicare receipts were last year. The conversion factor for that, and this is preliminarily because we're still just looking at this data this morning, is about 6.19% of whatever their Medicare receipts were, and this is for both hospitals and for providers.
So how does an individual provider access funds? Is a hospital may be able to get 6.19% of Medicare receipts from 2019. How about the individual provider? You alluded to the Paycheck Protection Program, and there are some other programs I know are being under discussion, like Medicare Advanced Payment Program. How does the individual practitioner help to protect his or her practice so that his or her employees can stay employed and the group can stay together to provide care for patients after this pandemic?
So let's break this into 4 buckets. And the first bucket is the one that I've already mentioned, where on Tuesday they announced that the Public Health and Social Services Emergency Fund, the total in that fund is $100 billion. And they announced that they were going to be beginning to disperse $30 billion of that today. And as our understanding, that's indeed happening. It is automatic. Providers don't need to take any action. It will be dispersed into their account based on their taxpayer identification number. The next thing that I will mention is the Medicare Advanced Payment Program. And that program went live about 11 days ago now, actually 12 days ago now. And since then, the government has dispersed over $34 billion in funds to providers in that program. Now, a couple of caveats with that program is this is essentially an advance on future Medicare receipts. And the way it works is you contact your Medicare administrative contractor and you request this, and they will allow you to request up to 3 months of Medicare payments in advance. Medicare will not seek to recoup any of that for 120 days, but beginning on the 121st day, as it currently stands, they will seek to recoup that based on additional bills that they receive from providers, with the idea currently being that they would recoup all of that in the next 90 days. I will note that this is a source of advocacy ongoing with us, both in terms of how quickly they try to claw this back, the amount of time given to take it back, to reclaim the loan, as well as the interest rate on any remaining balance. The third one that I will mention is the Paycheck Protection Program, and that's the one that we've heard a lot about in the news. Congress initially put $349 billion into this program. Important to note that this program, you access it through your local SBA affiliated bank or financial institution. This one is not accessed directly through the SBA, through your local bank or SBA affiliated institution. This one we are getting a lot of feedback on that the application is very complex, and that surgeons would be well advised to engage the assistance of their professional tax advisor, both for information and an assistance in filling out the application for this program. And then the last one that I will mention is perhaps the one that has been the least noted in the last 10 to 14 days, the Economic Injury Disaster Loan Program. This one you apply for directly to SBA, the Small Business Administration, and you can get up to $2 million for economic support due to loss of revenue because of the pandemic. And everyone throughout the country, all 50 states, is eligible. I should note that the Practice Protection Committee has been working very diligently to provide information on these programs, and a good summary of this information is available on the Practice Protection Committee section of the newsletter that all fellows will receive.
So that was going to be my next question. Ongoing, what is the best source for fellows to access to find out what the Practice Protection Committee and the Division of Advocacy and Healthcare Policy are doing on a seemingly beyond daily, as an hourly basis? So where's the best source of the information?
Yeah, I think that you're correct, and that things are moving very, very fast with this. I think that the newsletter is an excellent source. The Practice Protection Committee's document is set up in such a way that we can update, add to it on a bi-weekly basis if necessary. We are gauging our other communications sort of based on what we feel like the urgency is. The newsletter is going to be the primary mode, but as we saw earlier in the week, when something comes out like the news that was released about the Public Health and Social Services Emergency Fund, we may well communicate that via an all-fellow email.
So a lot of work is obviously being done by you and your group on the pandemic itself, but as the pandemic surge hits and we're on the backside of it and life hopefully starts to resemble some degree of normalcy, what plans are you making for the ramp up, and what sort of preparations from the fiscal and other legislative areas that need to be addressed?
Yeah, I think the big focus that I have right now is just trying to make sure that folks have enough good information and resources to weather the storm. There are lots of things that people can look at with regards to other advice from their professional tax advisor and their professional financial advisor to help them weather the storm. The college has got an ongoing effort that Dr. Hoyt, Frank Opelka, and Cliff are involved with regarding ramp up and how to sort of bring back things back to a more normal state of affairs. And I know they're working very diligently on that, and that information will be forthcoming about it.
Are there any other topics that our fellows and other viewers should know about that are under the jurisdiction of your group?
Yeah, I think that some of the other things that people sort of lose sight of is the individual states. And one of the things that we're starting to look at with the state team is how these various executive orders are going to impact civil liability going forward in the declared emergency areas, and that's a source of things that we are engaged with. I think we're up to 7 different states now have issued executive orders that will be in effect during the period of declared emergency, and the state area in terms of individual fellows access, individual fellows advocacy is something I think that too often gets overlooked, and because police power is reserved unto the state, many of the regulations about what we're able to do are going to be impacted about what goes on with the individual state governments as well.
Well, thank you very much for your invaluable insights, Dr. Bailey. Thanks for the work that you're doing now during the pandemic and the work that you do year-round every year on behalf of the fellows and, of course, our patients to allow us to offer the best possible outcomes to our patients. I wish you and your loved ones health and safety, and look forward to seeing you in person when all of this affair is behind us.
Thank you very much. I appreciate the opportunity and wish everyone safety and good health.